So let's talk about the medications taken in Parkinson's disease and the different interventions that you need to know. I want to touch on cogwheel rigidity, and that's when they move their arms passively toward their body, there's jerking. So I want you to remember that. You want to educate your patients on consciously thinking about lifting their feet when they're walking. You want them to, as if they're in a march, to lift them up, because when you think about moving, when you say you want to do this, when you unconsciously want to move without thinking about it, okay, those are there are signals paired with that unconscious thinking to move, and that allows for you to move it. Then the cortex of the brain, it sends those signals to your body to move the way that your unconscious mind is telling it that it wants to move. Okay, so when you tell them to think about lifting their feet, it will help them remind themselves to do that. They're going to have coordination problems. They're constantly trembling. If they don't have their medicine, there is. So, okay, just know they're going to have coordination problems. They're at risk for safety issues. Teach them how to use assistive devices like their walkers or their canes. They need to have a rubber tip. Okay. Teach them to change their position slowly. They can lean on the cane. They don't have no rugs that can trip them because they have a shuffling gait. No pets, because they can don't put nothing that they can trip around something on, because we don't want them to hit their head. Okay, we talked well enough about the freeze ups. Don't push through those. Wear low heel shoes, shoes without a heel, because they have a shuffling gait and it's hard for them to move. They don't need something that will tilt them over or make them slip. So the first medication is carbidopa levodopa. Levodopa protects carbidopa, so that carbidopa carbidopa is put in the brain to get turned into dopamine. Okay, it adds more dopamine to the brain. That's what carbidopa does. The side effects to carbidopa is involuntary movement. Okay, because it is going to relax it, so it's going to, it's going to help with the involuntary. I don't know what it is, to be able to relax. I don't know what kind of excuse me, I don't know what kind of bug that is. It's been there for a while though. So if patients have been taking carbidopa for a long time, they can experience those moments when the medicines is wearing off before their next dosage. A medication that can help between that gap is called entacapone or Lamotrigine. It helps prevent the wearing off of the carbidopa medication. It fills it in, because this hurts. Your muscles are constantly being triggered by electric signals to move. That hurts. When taking carbidopa levodopa, you don't want the patient to be eating a lot of proteins. You really don't want that. give it all before you give them their medicines, because those proteins prevent the breakdown of carbidopa, or it prevents the absorption of carbidopa in the gut, and we don't want that with this. Another medicine that is used is Roquip or ropinirole. It stimulates the dopamine receptors. It's going to put more dopamine, make it more available to the brain. The side effect here is that it causes sleepiness. So when they take this, they don't want to be driving or doing any kind of activities, because they're going to be sleepy with this medicine here, Requip. Another medicine is called amantadine. It's used to treat influenza A. Okay, it's going to stimulate dopaminergic activity. It's going to increase dopamine for the brain. Okay. Another medicine is an anticholinergic medication called benzotropine or Cogentin. And what it does, it blocks the neurotransmitter acetylcholine. It blocks its effect. Acetylcholine is constantly being stimulated because, notice when we talked about that balance between acetylcholine and dopamine in the brain, there has to be a balance for normal movement of the muscles. But in Parkinson's, there's a decrease in dopamine, which is going to make acetylcholine increase, and that's going to constantly stimulate. That's why there's going to be constant stimulation of your muscles. Well, benzotropine is going to block the amount, it's going to block the effects of acetylcholine on your muscles. Okay, and that's what we need. Benzotropine is not for patients who have glaucoma, all right, because it's not, so don't do that. Don't stop taking this medicine suddenly. It will cause a dry mouth, and no alcohol here. Benzotropine is going to decrease the rigidity, of course, because it's going to block acetylcholine from constantly being able to trigger the muscles. Okay. Okay. It's going to decrease salivation as well. Because in Parkinson's, they will have some drooling because they're not able to use their mouths. I mean, their muscles the way they should. So they just sitting there with their mouth. So this benzotropine can help with that. Another medication is MAO inhibitors like Rancelene, Acylect, okay? It increases the dopamine by stopping MAO activity. When taking MAO inhibitors, or like Rancelene, Acylect, you don't want any foods that's high in tyramine. So those are that's aged cheese, smoked curried meats, fermented goods, or beer, because it's going to cause an interaction with the medication. I hope I gave y'all a better understanding of what Parkinson's disease is and how it's treated. There's no cure for this, okay? It's more common in older adults than it is younger, but younger people can get this. Thought to be triggered on by, it's not triggered, but you can get it from, like, they don't know how you can get it truly, but studies have shown that genetic mutations can make this disease arise. All right, I hope this helped. Thanks.